Chapter 24 Infections. Fever. A medical student has made some language notes on a case report. Case 45. A 24-year-old man present with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever, infection with Epstein-Barr virus. At the age of 18 years, he had returned from Africa 3 weeks previously. Fever, pyrexia. Also, remember PUO, pyrexia of unknown origin. Fever, also known as temperature. I've got a temperature. Adjectives: feverish, febrile, and pyrexial. Opposites: afebrile, apyrexial. Some symptoms of fever: sweating and rigors. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses or bacteria, that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable, unlike many non-infectious degenerative and chronic diseases. Communicability is another factor which differentiates infections from non-infectious diseases. Transmission of pathogenic microorganisms organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures like vaccines or by drug prophylaxis. Microorganisms include bacteria, viruses, fungi, protozoa. Another general word for this pathogen is microbes. Patients often refer to microbes as germs or bugs. Notice the common expression for adquiring an infectious disease. Could he have caught some disease from the dog? Or could he have picked up some disease from the dog? I think I caught the flu bug that's going around. Source and spread of infection. Here is an extract from a medical textbook. Infection may originate from the patient, usually from skin, nasopharynx, or bowel, or from outside sources. Often, another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organism in their throat, bowel, or blood. Non-human sources of infection include water, milk, food, animals, birds, and also the soil. Legionnaires' disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Infecciones. Fiebre. Un estudiante de medicina ha realizado algunas notas lingüísticas en un informe de caso. Caso 45. Un hombre de 24 años de edad acudió a consulta por fiebre de 3 días de evolución. Al tercer día había sufrido un ataque febril intenso con sudoración y escalofríos. Los únicos antecedentes de relevancia eran una hepatitis de 4 años de evolución y una mononucleosis infecciosa a los 18 años. Había regresado de África 3 semanas antes. Fiebre, pirexia. Fiebre, también conocida como temperatura. Tengo temperatura. Adjetivos: febril y pirexia. Opuesto: a febril, a pirexis. Algunos síntomas de la fiebre son la transpiración y escalofríos. Microorganismos. Las infecciones se diferencian de otras enfermedades en varios aspectos. Lo más importante es que son causadas por microorganismos vivos, como virus o bacterias, que generalmente se pueden identificar, lo que permite establecer la etiología en una etapa temprana de la enfermedad. Muchos de estos organismos, incluidas todas las bacterias, son sensibles a los antibióticos y la mayoría de las infecciones son potencialmente curables, a diferencia de muchas enfermedades degenerativas y crónicas no infecciosas. La transmisibilidad es otro factor que diferencia las enfermedades infecciosas de las no infecciosas. La transmisión de organismos patógenos a otras personas, directa o indirectamente, puede dar lugar a un brote o epidemia. Por último, muchas infecciones se pueden prevenir mediante medidas de higiene, vacunas, especialmente vacunas vivas atenuadas como la vacuna contra la rubiola, o mediante profilaxis farmacológica. Los microorganismos incluyen bacterias, virus, hongos y protozoos. Otro término general para estos patógenos es microbios. Los pacientes suelen referirse a los microbios como gérmenes o bichos. Tenga en cuenta las expresiones comunes para contraer una enfermedad infecciosa. Podría haber atrapado alguna enfermedad del perro o podría haber recogido alguna enfermedad del perro. Creo que me he contagiado del virus de la gripe que anda por ahí. Fuente y propagación de una infección. A continuación se muestra un extracto de un libro de texto de medicina. La infección puede tener su origen en el paciente, generalmente en la piel, la nasofaringe o el intestino, o en fuentes externas. A menudo otra persona que puede estar sufriendo una infección o ser portadora de un microorganismo patógeno. Los portadores suelen estar sanos y pueden albergar el organismo en la garganta, el intestino o la sangre. Fuentes de infección no humana incluyen el agua, la leche, los alimentos, animales, pájaros y también el suelo. El periodo de incubación es el periodo comprendido entre la invasión de los tejidos por patógenos y la aparición de las características clínicas de la infección. El periodo de inefectividad es el tiempo en que el paciente es contagioso para los demás. Match the two parts of the sentence. Look at A, B, and C opposite to help you. In 1988, saw the UK launch of live Attenuate, measles, mumps, and rubella vaccine. Chickenpox is a common infectious disease of childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained febrile with peaks of temperature of 39.5 Celsius. He was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic of AIDS. Measles rubiola is most infectious during the catarrhal stage. Lyme disease is caused by transmission of B. burgdorferi from animal to man by ixodes ticks. Complete the case report of a patient in a opposite. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentences. An infection which can be treated successfully with antibiotics is curable. Another word for an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is a febrile. The common infection with Epstein-Barr virus is known as glandular fever.